Hello everyone. So today let's start with a question. So let's try to answer this. Which of the following is not true regarding this lesion? And then we have a histopathological image of the same. So first, to answer this question, there are few things that you have to notice. First one is to underline the text which is not true. Most often during exams we miss out on the not true part and just assume that it is true, and we start finding the answers and it might get wrong. So the first thing is we have to observe that it should be not true, and then to diagnose, to make this answer right, you have to know what this condition is. So let's come back to the question after we finish our session, so that I think almost every one of you will be able to answer this. So coming to this lesion is known as a fibroadenoma. As we know, it's one of the benign conditions of the breast, and it is the proliferation of stromal and glandular events. So what is it? It is stromal and glandular proliferation. So here you can see that all this pinkish area, whatever pink, I will say this is eosinophilic pink, whatever is the stroma, whatever you see there, and everything that you see which is more purple, which has nucleus and cells which are forming glands with a small lumen inside them, are the glands. So when the proportion of stroma and glands increase in a breast, that is when this condition arises, fibroadenoma. So there are one more point that you have to remember in this, that they are well circumscribed tumors. Okay, now let's move on to a few basics. Again, these two images are the low power magnification of the same. So what is the age group? They usually arise in 15 to 25 years of age, that is younger females. And then there are two types of fibroadenoma. One is intracanalicular and the other one is pericanalicular. So how do you differentiate between intracanalicular and pericanalicular? So that is where the histopathology comes into picture. As you can see, the stroma is increasing, and what is it doing? It is pushing the glands to make them form a slit-like pattern. So all of these glands are just like slits. So because the stroma is pushing them and compressing the lumen to form slit-like glands. So this pattern is known as intracanalicular. When the glands are pushed and they form cleft-like or slit-like pattern. And so what is this? It is exactly what I've explained here. This is also intracanalicular. As you can see, stroma is pushing the glands and making them into a slit. So what is pericanalicular? So pericanalicular is where you see that stroma is also proliferating and even the glands are proliferating, but the stroma is not compressing the lumen of the glands. So I will, assuming this is a stroma, the glands will just be round, uniform glands, uniform and variably sized glands. So if this pattern you see with the same morphology, that is when you say it's a pericanalicular pattern. So coming to the size, so if it is less than 1 centimeter, we call them small. Less than 3 centimeter, that is when we call that is normal fibroadenoma. Usually they will be less than 3 centimeter. And if you see, this is important, if it is more than or equal to 3 centimeter, that is when we call them as giant fibroadenomas. Okay, so coming to the last 2 points, what is the investigation that we usually do? It is an ultrasound. And what is the treatment if a fibroadenoma is less than 3 centimeter, and what if it is more than 3 centimeter? So in less than 3 centimeter, we usually do cryoablation or ultrasound guided vacuum assisted biopsy. However, in greater than 3 centimeter, we usually do excision, also known as lumpectomy. So usually fibroadenomas grow up to 1 to 2 centimeter and they become stable in their size. Sometimes they may regress or sometimes they may increase in the size. So the progression of fibroadenoma is variable. However, the investigation of choice is USG and the treatment is cryoablation. Let's go back and try to answer this question now. Which of the following is not true regarding this lesion? So first we have to remember not true. Then we have to remember that this is a fibroadenoma and everything that we studied is right here. So predominantly occurs in younger age group. Yes. Greater than 3 centimeter are characterized as giant. Yes. Fixed to the underlying tissue. So this is one point that I forgot to say. They are usually mobile lump. Addressed as mouse in the breast because of their feel, they're so mobile you cannot fix them. They are not fixed to the breast. So this is not true, and less than 3 centimeter cryoablation is not recommended. Again, this is also not true. So these two are false and this two are true. I hope you understood this small concept. Thank you.